Is there scientific evidence for acupuncture for bladder problems? Imagine finding a natural way to help with bladder issues that might be less invasive than medications. That's where acupuncture comes into the picture. While it's been used for thousands of years in traditional Chinese medicine, scientists have also started exploring how it might help with bladder problems. Research suggests that acupuncture could help with certain bladder conditions, especially overactive bladder. Overactive bladder causes frequent urges to urinate, urgency, and sometimes incontinence. Some studies indicate that acupuncture might reduce these symptoms by affecting nerve signals that control the bladder. For example, in animal studies and some human trials, acupuncture appears to inhibit nerve activity in the bladder that leads to involuntary contractions. It may also influence parts of the brain and spinal cord that regulate bladder function, offering a neurophysiological explanation for its effects. When scientists review multiple studies, they find that acupuncture can sometimes be more effective than sham treatments, which are fake procedures used in research. In some cases, acupuncture has been shown to be as effective as medications used for bladder control. Combining acupuncture with medication might even provide extra relief for some people. However, it's important to note that the quality of these studies varies. Many have limitations, such as small sample sizes or inconsistent methods, which means the overall evidence is considered low to moderate. Acupuncture has also been looked at for urinary retention, which is when the bladder doesn't empty properly. Some clinical trials suggest it could be a safe and helpful option for this condition. For people with mixed urinary incontinence, some studies found that electroacupuncture, a form of acupuncture that uses electrical stimulation, reduced urine leakage and improved quality of life compared to standard treatments. From a traditional Chinese medicine perspective, acupuncture aims to restore the flow of qi or vital energy in the body. While this idea is different from Western scientific explanations, the focus in clinical studies is on measurable improvements in symptoms rather than these traditional concepts. It's very important to remember that acupuncture should not replace standard medical care for bladder health or bladder cancer. Always talk to healthcare professionals for diagnosis and treatment options. Acupuncture might be considered as a complementary therapy after discussing it with your doctor, especially if you want to explore additional ways to manage your symptoms. In summary, there is some scientific evidence suggesting that acupuncture could help with certain bladder problems like overactive bladder and urinary retention. It appears to influence nerve activity and brain pathways involved in bladder control. However, more high-quality research is needed to confirm how well it works and to develop clear treatment guidelines. Always consult your healthcare provider to find the safest and most effective approach for your individual needs.